So I see we've entered our cave mode with the blinds, so if you need to grab some coffee or tea to stay alert, please do. So it gives me great pleasure to introduce our next speaker, Larissa Bartlett. So Larissa is here today as a doctoral candidate, also at Menzies. So Larissa also holds an elite PhD scholarship sponsored by the Commonwealth Government and TAS Networks. So Larissa's work program is exploring the potential of mindfulness training for workplaces as a way to contribute to both the prevention and management agenda for mental health and stress-related conditions. So welcome, Larissa.
Thank you, Christy, and good morning, everybody. I shall endeavour to stick to my time frame so that we're all off out at the right time. So thank you for having me. I'm thoroughly enjoying being a PhD student. It's a great privilege. We've been listening to some very well grounded discussions on stress and work and mental health. So we know that stress is a response to a challenge and that distress arises in response to our perception that we're unable, we don't have the ability to meet that challenge. Stress has outcomes on the cognitive, physiological, emotional and behavioural domains. It can be cyclical and lead to poor outcomes. It's prevalent and costly for work. This is a very short summary of a very complex and deep topic, but I think we're reasonably familiar with that. So my study is looking at mindfulness, as Christy mentioned, mindfulness in the workplace. For those of you who've probably heard of mindfulness, it's popular in the zeitgeist at the moment. It is commonly defined a dispositional state of paying attention intentionally and without judgment to the thoughts, emotions and physical sensations that arise in response to whatever's going on at any given moment. So it's about being present and being aware, paying attention non-judgmentally. Mindfulness, the theory around mindfulness is that it allows response flexibility, which is essentially that pause between the stressor and your response. So a mindful moment might be that we notice the stressor, we notice that we're presented with a challenge and we take that moment and then we decide what to do with it. The opposite of that is to respond, to react without doing that processing. Mindfulness can be cultivated through a practice or intervention. Typically, the most common practices of mindfulness these days are around meditative practice. So we're spending a period of time paying attention to those thoughts, emotions and physical sensations without reacting to them. It's sort of like if you practice the violin half an hour every day, you'll have that skill to use when you want to pick up the violin. Mindfulness practice is intended to build that set of skills so that when you need them, they're there. You don't react, you respond. It's shown to be effective in clinical and community settings for reducing stress and improving mental health on those domains which are common to the domains in which stress has its effect, on the cognitive, emotional, behavioural and physiological domains. Some 30-odd years of research on standardised programs or interventions to train and teach mindfulness show this evidence that there is a reasonably consistent effect in community and clinical settings. Those programs involve approximately 2.5 hours a week over a period of 8 weeks and then daily homework of 45-odd minutes or so of practice. So it's a fairly time-intensive training program that we're talking about that has been shown to have these effects. Very good effects, but it's intensive. So workplace mindfulness. We can't really assume the same outcomes for a mindfulness program that's delivered in a workplace and that's adjusted to fit within work contexts. That time intensiveness of those standardised programs are problematic for a workplace. It's costly for time off work and just logistically difficult to roll out a program of such time commitment in the workplaces. And so workplace mindfulness programs, there are a lot of them, but they're typically adapted from those standardised formats. They're shorter, they have less content, and they vary in delivery mode. So it's not really appropriate to assume the same level of outcome from the standardised programs into work environments. And similarly, there's a wide range of work environments, as you will know, and employee profiles. And so what works for whom is in those workplace contexts is a question that's worth exploring. Also, does increased mindfulness contribute to other work outcomes? So we understand that mindfulness is good for flourishing, for improving well-being, and for building, but we're interested in the strengths and capabilities that are relevant to work that mindfulness might also improve, such as citizenship, deviance, safety, leadership, productivity and engagement. These are all outcomes that are proposed in the public media and in the publicly available literature. You can see the promotional, sorry, I shouldn't say that. You see articles claiming these outcomes and they sound very promising. So what we want to look at really is what results from work-based studies, so mindfulness interventions that are delivered within the workplace environment using, and we wanted to look at study designs, so research designs where you could draw a causal conclusion from that the mindfulness intervention actually is the thing that is making these outcomes occur. So our first study for my PhD is to do a systematic review and meta-analysis of randomised controlled trials of mindfulness interventions that are delivered within the work environment. I found 19 studies that fit this randomised controlled trial methodology. The programs that were delivered and evaluated were widely heterogeneous in dose, that's duration, in mode. Some of them are online, some of them are face-to-face and in group settings, and in content. So some include a movement component, some are just body scans and audio tracks, some involve a fairly sizable education component. Most of the studies have small samples. There's only 2 studies with samples over 150 people. There's problems with study design in terms of blinding and randomisation to groups. The results were entirely reliant on self-report questionnaires, which is a perfectly valid way of gathering evidence, but given the amount of effort that's involved and commitment involved in participating in these programs, there's a fairly strong potential for what we call response bias. I've been doing this and I feel great, so I'm going to tell you I feel really good, which is fine, but there's no objective measure which has been consistently used in these studies. And also the health and education sectors have been, by a long shot, the most frequently evaluated workforces. And so what we want to know is, well, what about other workforces? What about other people who work on the poles and wires at Tas Networks, or the people who are at the frontline service desk at Service Tasmania? What happens with these guys? Does it work for them? So the preliminary results from this systematic review are essentially that the work-relevant outcomes beyond personal wellbeing measures are very infrequently assessed. Typically the mental health outcomes are the core findings of these studies, but those promised outcomes around organisational citizenship, safety, deviance, leadership, relationship quality, very infrequently assessed, and so therefore we wanted to see a little bit more evidence around that. And my continuing work, which is to pool the data from these different outcomes and do a meta-analysis, I hope will be able to show us what the size of effect across all of these studies, despite their variation, might be on those outcomes. I suspect we'll only be able to do that for a couple of the mental health outcomes, including stress and distress. So the second study that I'm doing for the PhD taps into that notion of the self-report, the problem, the reliance on self-report. And I'm developing a measure to be used by the peers, colleagues, family members, friends of people who participate in mindfulness programs. Because I want to know whether there's an observed change, whether in the work, so we know that I feel better because I've done a mindfulness program and I've told you that, but does my colleague notice that I'm no longer flying off the handle at the latest request to do a bit of work, or is it making a difference in my workplace? Is my more mindful behaviour actually resulting in a change in my work environment? So I'm hoping to develop a measure which will at least start to be able to assess those sorts of changes. I will be recruiting pairs for this study, and I have some business cards sitting on my table. If anybody's interested, if you're doing a mindfulness program or you know somebody who is, I'd love to talk to you, and I'd love to pop you on a mailing list. I have the same problem as Kate. I don't have ethics yet, so I can't recruit into the study, but I will be developing a mailing list to be able to go out and call for your participation. The third study will feed on from those two. So I'm running the measure development and the review at the same time, and the outcomes from my review will inform the questions I ask in a much larger pragmatic trial. I'm hoping to run in 2017-18, which will look at the effectiveness of different mindfulness interventions. So we're looking at apps, face-to-face programs, online delivery, a range of different programs of different duration and content. In different work environments, I'm interested in getting a really good spread of different types of worker profile. And I'm going to be looking at mental health and wellbeing outcomes to be able to compare efficacy with other programs. But also I'll be testing the observed mindfulness measure to be able to report on observable outcomes and work performance outcomes, including productivity, citizenship, deviance, and so on that I've mentioned earlier. Again, I'll be recruiting. My card's on the table. To wrap up, my contribution, I'm hoping throughout the course of the PhD, will be to develop a clear understanding of the evidence of workplace mindfulness training by program type and employee profile. I'm hoping to create an inexpensive and scalable way of measuring the noticeable changes that occur following mindfulness training, and to measure the extent to which the promise of mindfulness matches the reality. So thank you very much for your time.